Good morning, good morning, good morning, Liberty County, and Happy New Year to you. We have to be back before you again to restart our COVID updates from our community. I want to say Happy New Year to all of you. Hope you had a good holiday season. And as this new year unfolds, we still have some challenges. In fact, just as the science said, there's been some upticks in our rates, positivity rate, so we're having to deal with that, and we hope you're on board with helping us to deal with that. Now, before we signed off for 2020, we asked you to remember the formula that works so well for us, and we hope you have done that. But we do know that from the people having their travels and being with family members, there's been the surge that the scientists have predicted. It is happening. It's very real. So my point to you right off the bat is it's very real. It's very real. It's very real. So now that we had the turkey and dressing and all that stuff, we got to get back to being who we are and being compliant so that we can try to curtail the spread of the virus in our respective communities. So we need your help with that. Can't do it without you. Happy again to have Team Liberty behind me here. If I may make personal reference to having Dr. Perry here from our Liberty County School District, because he has 10,000 plus children under his supervision, and he's trying to keep them safe. Then he has X number of staff members, so he has a big job. He has a big job. We want to say again to him publicly, we are behind him, and we support what the Liberty County School System is doing to keep our staff and our children safe. So it may, and he's going to give his report in a little while, so it may take us being in virtual a little longer than we want to, but I'd much rather have you virtual and healthy than in person and on somebody's respirator. So that's the way I look at it. That's the way I look at it. So we're going to do our best that we can to provide the very best service to you. So if you would just tune in once again to hear the reports from our respective communities, I think I'm going to invite to the podium next to Honorable Larry Baker, Mayor of the City of Walthamville.
Thank you, Mr. Chairman, to Team Liberty, citizens of Walthamville, Happy New Year. I'm here today to let you know that the city of Walthamville has been exposed. We had to close the doors on yesterday, and we'll hopefully we will resume back to business on Friday morning. We have 3 cases there. We had the building closed and sanitized, the police department alike. So as we continue on to wear our masks, wash our hands, and stay our distances, we'll move forward. So thank you so very much. At this time, I yield the floor to City Manager Kenny Howard, City of Hinesville.
Good morning, Liberty County, Hinesville. Happy New Year. Just want to reiterate what Chairman Lovett and Mayor Baker has said in regards to maintaining our distance and actually wearing our mask and doing all the CDC guidelines that would help keep us safe and the precautionary measures that are already in place, that we continue to adhere to them. The mayor is not here today. I'm filling in for him, and I'm going to try to do my best to read my talking points given to me by Ms. Whitney. And I realize that members of this community, we've had an uptick in cases in Liberty County and in Hinesville. We realize that that is because of the holiday season. We understand that for the most part, you have perhaps gathered together with your family and friends and loved ones, and as a result, we've returned to work. And because of that, we have seen an uptick in cases here in Hinesville, and specifically within several of our departments with the city of Hinesville, our police department, our fire department, and inspection department at City Hall. We currently have right at 30 plus employees who are in quarantine at this time. We have 5 positive cases as I speak, and several of them are being tested now. What does that tell us? That tells us that this virus is still alive, and hasn't gone away because we went from 2020 to 2021. The virus is still here. And so based on the current available stats in Liberty County, we currently sit at 1863. That's 1,863 cases in Liberty County. Now, since the last time we met, which was on December 16th, we had 224 cases less. So we have basically exposed or contracted an additional 224 cases since the last time we met. Liberty County, regardless of where you are on this issue, you must agree that those numbers are just not acceptable. It points to some level of complacency, and that's just not something somewhere that we need to be. And so we're asking you, we're pleading to you at this point in time to please continue to watch your distance and wear your mask and wash your hands, because these are the guidelines that have been given to us from day one. And it's a proven fact that these precautionary measures, they do work. And if we continue to do that, then we could somewhat get back to some sense of normalcy in this community. But until then, we will continue to have these uptick in our numbers. So we're going to basically ask you to continue to watch your distance, wear your mask, and wash your hands. In addition to that, the city is still following Governor Kemp's order. Governor has extended his public health emergency order until Sunday, February the 7th. And the mitigation requirements are in place until January 15th. And so we're basically still doing what we have been doing for the last 9 months. But once again, we need your help. And as a result, we are canceling the MLK parade this year. That parade was to be held on January 18th. That event will be canceled due to the fact that we have an uptick in cases in Liberty County, and we want to keep everyone safe. So we're going to ask that you understand it is not anything that we wanted to do, we plan to do. We really wanted to have our MLK parade, and I've already gotten some calls since I mentioned this earlier this morning. But we want this community to remain as safe as possible, and we need everyone's help. With that, I'm going to yield to Dr. Perry. Dr. Perry, our superintendent of our school district here in Liberty County, would come and share some insight so far as the things that they're doing in our school system. And once again, please, let's work together. Let's stay the course. Let's not become complacent, because we have to have each other's back and watch out for our fellow citizen here in Liberty County. And without any further ado, Dr. Perry.
Thank you, Mr. Howard, and to Team Liberty, and thank you all for including the school district into what you're doing and to inform the citizens of what's going on in the county. And I want to say Happy New Year to everyone, and say that in the school district we realize, as you've heard, that we have to be a part of this too. We love educating children. That's what we do. We know how to do it. But safety, keeping our students safe, keeping our parents safe, has taken priority in that. So we just feel like with 10,000 students and 1,600 people, we have to participate in trying to keep the spread of this down. And that's exactly what we're doing. But the good news is that because of the citizens in Liberty County, we have the system to still deliver education to our children, and that's through virtual. All of our students have, because of how you have supported our district, they all have their own iPads. The ones that didn't have internet connection, we have given them hotspots, so everybody will have access to that. And that's the delivery method that we're doing. As you know, we delayed school in phase until the 20th. And we're hoping and praying that we will be able to make that date. But right now, our students are virtual, and I guess if I could make a plea, it would be to parents, and if you're not a parent, if you talk to a student, please encourage them to sign on, to do their work, to be there, to work with us while we work through this. One of the problems that we're having is that some students are just not doing this, and that there could be several reasons. Maybe they don't have the supervision at home or whatever, but anything that we can do to get our students to participate in the virtual until we can get them back would be appreciative. Now, the other thing is we're following, the good news, I think, is the new CARES Act that was passed. We're told that there will be some funds that's going to be coming to the school district that we will be able to use to catch our students up. We know that there are going to be some students that's going to be behind. So what we're working on right now is two things. Number one is we want to keep everybody as safe as we can. And number two, we want to start working on, when we get our students back, what are we going to have to do in order to catch them up, and how quickly can we catch them up? And so staff, teachers, our administrators are working on that plan. Lastly, I'll just say, I just want to thank everybody. I know this is tough. This is tough for our students. You know, students, we know they need to be in school. They need to see their friends. We understand all of that. And we know it's a sacrifice on some parents, and we understand that. But we are going to do everything we can do to make this as accommodating as we possibly can, at the same time helping this county, helping all of us stay safe until we can work through this. Again, please call us. You know, we're all in this together. Liberty County, we're leading the state and the nation. I was on a call with other superintendents, and let me tell you something. We have a lot to be thankful for in Liberty County, and how we are actually handling this. So my hat's off to our teachers, our staff, our parents, and definitely to those students that's out there dealing with this. We'll get through this. I know we'll get through it, and once we get back, I'm telling you, we're going to be prepared to do it. We are working on. There have been some questions about prom and what are we doing for our seniors. We plan some kind of way. If we have to have a prom on the football field, we're planning to do some things for our seniors, and we are working with them, but to do those things that they really need. And I guess in a nutshell, we're trying to give our kids as much as we can, at the same time keeping them safe and whatever. So that's our philosophy right now, is give them as much as we possibly can, at the same time making sure that everybody is safe, and that we help the county keep down the spread of this coronavirus. Again, Happy New Year to everybody, and you know, we just gonna move forward and make this thing work for our children. Thank you so much.
Thanks, Dr. Perry, and I start off by saying again, hats off to all the teachers and educators. I walked into one of our offices this morning, and one of my employees was on the phone with somebody, and I said, "What are you doing?" She said, "Virtual learning." I said, "Virtual learning? Are you dialed into your child?" And she said, "I'm dialed into my husband, trying to teach him how to teach the child." So that'll go on. We're all in learning mode, and we all continue. I do want to express Happy New Year to everybody, and I hope it's going to be just one of the most fantastic New Years or years that we've had. Certainly going to be better than 2020, I know. Some of the statistical information has been talked about. I'll jump to some of that just real quickly. The daily average, as you've heard, has increased. That's actually up from like 9.7 to from 6.7 during our last report on the 16th, and that community transmission index has really jumped. That is that gauge of indicators that we want to try to keep below 100. It was at 120 during our last report, and as of a couple of days ago now, it's at 207. So it's about doubled on that, according to the website this morning. The percentage of positive tests is up from 9.1 to 14.6, and those are some rolling averages over a 7-day period, I believe it is. Probably no new news here, but the first case of that COVID-19 variant was discovered in Georgia officially yesterday. It was an 18-year-old male that had not a lot of history of travel, located in North Georgia. That variant now has a name, just like everything else, and that's, just for your information, is variant B117 of that disease. Again, from what they're telling telling us is doesn't seem to be any more serious of a type of virus or variant, just a more rapid spreader. So even more to do what you've heard before, and that is to continue to mask and continue to keep those distances. I want to talk a minute about vaccinations and what's going on in our local area. We have started vaccinating, the hospital actually, as a partner with DPH locally, has started to give some of those vaccines to healthcare workers. The vaccine process is laid out in priority groups on DPH's website. I'll give you that website information in just a second. We're currently in what's known as phase 1A, which is a very limited vaccine dosage availability, and it's being given to hospital care workers, care home workers, and those on the front lines. On December 30th, Brian Kemp and Commissioner Tomey have announced that they were going to add adults age 65 and older, law enforcement officers, firefighters, and first responders to that phase 1A group, which they have done. Locally right now, those sign-ups are happening, and those scheduling of the vaccines probably to take place as early as this week, next week. Some of them have already been administered in some adjoining counties, so that is on a rollout. As we talk about those vaccinations a little bit, right now, the next phase of that is a phase 1B, where critical workforce employees, educational faculty and staff, correctional facility staff, court employees, food processors, grocery store workers, right now are scheduled to be in that phase 1B, which would be followed then by phase 1C, which those are adults of 65 and older and their caregivers, and adults below age 65 with complications would fall into that. I won't go much deeper into the phase 2, phase 3. Again, these are available along with a lot of these statistics on the website at Coastal Georgia Health, and that's covid19.gachd.org, and you can look at that and get all the vaccination information. That will be the site, by the way, that you'll go to, from my understanding, when general population starts to get some sign-ups, as well as some of these age groups, where you will go in and actually make a reservation and sign up to get some of those things done. So please get used to looking at that site. Our general offices, not to the extent that the city unfortunately has going right now, but we do have some outages in some key positions because of COVID-19. That comes and goes, it's up and down. We continue to do what we need to do to be safe and monitor that, and exclude those from the workplace who might pose a risk to others. Court facilities, there's been no change. In the recreation arena, as we reported last time, there are certain facilities and venues that are available under certain protocols. You'll need to contact the recreation department to talk about the use of those facilities. Most of the organized sports programs scheduled for spring have been given the green light at this point by the commission to at least encourage sign-up. That should start next week with some release forms and things that parents will need to sign in order to get their kids registered. These events, though, I want to assure you one thing: both the Recreation Board and the commission and staff of the recreation have consulted CDC protocol guidelines for these type of outdoor events, as well as the Georgia Recreation and Parks Association guidelines that's been established. So again, those sign-ups for spring sports, if they're outdoor related, and I'm talking baseball, t-ball, softball, those outdoor events should start next week. So you want to visit their website to see that. The only activity that usually occurs in spring that is an indoor event that unfortunately won't be able to be held this year is volleyball, and that generally occurs at the Schumann Recreation Center. So again, please go to libertycountyga.com. You can click on the Recreation Department link. It'll take you over to their page, and you can get more updates on that. Well, the last thing, I guess, the elections of January 5th are over. That would be unless both candidates get the exact same number of votes, in which case there'd be a runoff. So we're hoping that doesn't occur, to tell you the truth. What an election season we've been through, and all the nuances of the election changes and the pressures under the COVID environment. I think there were some times we didn't think we'd all make it, but my hat's off to all those election officials and workers who rode out the storm. And locally, I think they did a very good job. Commission meetings are still limited, only to those folks that have things on the agenda, but do watch us on Facebook Live, and you'll be able to see what's going on, and those are recorded, so if you have to watch part of them, you can watch the rest later. In looking at the numbers of the surrounding counties in our coastal district, and on a positive note for Liberty, we are on the lower tier of what we're seeing in spikes. And that is, I think the chairman said it at our meeting last night, that is because Team Liberty, you, all the governmental agencies, and the people in this county are doing something right. And I would just echo what these gentlemen before me have said. Keep doing it right. We're right here on the heels of getting the vaccine. We're holding our numbers in the lower categories, even though we are seeing some escalation from the holidays. It could be much worse. Don't let up. Don't let up. This is like the fourth quarter. The clock's running out. You've got to continue to push on that ball one more time. Don't let up. We're almost there. So God bless. Please stay safe and protect yourselves by masking anytime you go in public. Thanks.
Thank you. Team Liberty members, Mr. Brown, as you were speaking, I was reminded, certainly I think most of us know this is a very mobile community, being a heavily military community. People are coming and going all the time and everywhere. So for us to be where we are with our stats, that's pretty good, being a community that moves around. I know, Dr. Perry, you know about that. Students are coming and going every day. So we appreciate what we've been able to accomplish being a community like ours in this coastal health district. But as we say, we can't let up. We do want to emphasize what Dr. Perry said to our parents and to our next door neighbors, aunties, uncles, whoever. Let's help our students out with getting online and keeping up with their work so we don't get so far behind. Because when it comes to being a growing community, which we are, we need to make sure that our educational process works here and works very well, because we're trying to make sure that those young people are able to move on and move up. And when industry looks at coming to your community, they look at grades and they look at test scores, all those kind of things. Now, I know that we will probably be in a pool with a lot of others who are going through the same things that we're going through, but you know, in Liberty County, we take pride, and we don't want to be second to nobody. So while other communities may accept some lower score, lower test score, let's try to keep ours as competitive as they can be, so that our students are competitive no matter where they go. We like to say we send them to Harvard and Yale and Stanford if we need to. They can go there and compete with any other students. So parents and community, let's all stand behind our students who are school-age students to ensure that in spite of them feeling isolated, that they at least embrace the virtual experience and do the very best they can. And I'm glad to hear some funding may be coming to help with that. So we really want to emphasize that while we have this opportunity. So thank you once again for tuning in. We're going to do this every 2 weeks. Am I right, gentlemen? Every other week. So we'll be back again. So, but in the meantime, don't forget, y'all want to help me out? Wear your mask, wash your hands, and watch your distance. Thank you. Have a great day.